Cabinet Secretary, you obviously this is a pilot, and it's very localised at the moment, and it will need to be evaluated in the round once it comes to the end. But one of the challenges that we obviously have in Scotland is the extremely high number of drug deaths. You know, it's 1,172 people died last year, and every single one was a tragedy. So if the pilot is judged to be a success, would you look to see the rollout of further drug consumption rooms around Scotland in order to, with a view to tackling that extremely high number of drug deaths?
Mr. Murray is correct, Chair, that the intention behind the facility is to reduce harm and to reduce the number of deaths that we're seeing from substance dependency in Scotland. Clearly, we will be evaluating the efficacy of the drug consumption facility in Glasgow during its pilot operation. If any other area in Scotland is looking to come forward with their own safer consumption facility, then they will need to come forward with those proposals. I've already had interest from Mr. Murray's area in Edinburgh and from other parts of Scotland where there may be proposals to come forward, but that is for those local partnerships to establish. That is for them to come forward with that proposal, to do so in the same way that Glasgow did. That does not necessitate having to wait until the end of the Glasgow pilot. That could happen before then, but clearly it's for those local areas to come forward with their own proposals and for those to be judged on the same merits that the Glasgow proposal was.
Well, I understand that it's for local areas to come forward for their own proposals, but you're responsible for the national figure of drug deaths. So I wonder whether you have a view on how many drug consumption facilities you would want to see across Scotland in order to make a meaningful, substantive impact on the overall drug death numbers. Do you have a view on that, or are you agnostic?
No, I believe that the pilot in Glasgow is right for us to take forward so we can judge the efficacy from a national policy perspective. Whether other facilities may be established in other parts of Scotland is for those local areas to take forward those proposals. But we've set out the very clear policy position on seeking to come forward with as many harm reduction measures and take a public health approach to the substance dependency issues that
Sorry,
we're
Cabinet
facing.
Secretary, sorry to interrupt, but are you saying that even if the project is judged a success, you are agnostic on whether any further drug consumption facilities open?
No, no, that's not what I was saying. What I'm saying is that the efficacy of the pilot needs to be judged. That then helps to inform wider government policy. It's for local areas to determine whether or not they wish to come forward with a similar pilot. I would be supportive of that and believe that that could help to continue the work of harm reduction across Scotland. As I've said, there have been calls from some parts of the country, including from Edinburgh, for a safer consumption facility be established there. But it is for the local health and social care partnership to come forward with that proposal to establish it. They would be the ones that need to run it, rather than government dictating where they are at this stage, while we're in the process of working within the law as it stands. And I point Mr. Murray again to the conversation that we had earlier around the legal frameworks and around the consideration that the Lord Advocate has to take on a case-by-case basis, because there isn't a firm legal framework that allows for this to be established on a more widespread basis.
Thank you. And what's your, if there were to be further drug consumption facilities, do you have a view on whether they should follow the model of the Thistle, or would you be open to further pilots that take different models?
We've already spoken about inhalation facilities. Ms. Bios has pointed to the international evidence there. I'm also acutely aware of the drug consumption patterns that we are seeing and how that is driving drug-related deaths, and that is not just on an injection basis. So I recognise that other models could come forward, and that will be for, first of all, the local partnership to determine what they feel is most effective. But crucially, and this was the way that the Glasgow facility was able to be established, for the Lord Advocate to be comfortable that the policy intent behind that facility is within the legal realms that she has judged is possible for the Thistle. And so that's going to be a critical consideration for any local partnership coming forward with a proposal for a similar or a slightly different model from that of the Thistle. But again, stress to Dr. Murray that in order for that to be successful, it's for a local partnership to consider and for the Lord Advocate then to rule as to whether or not, in a similar vein to the Thistle, she can grant that statement of public prosecution policy. It would be much better if the Scottish Government did have the powers to establish these ourselves. Short of that, the UK Government needs to review the Misuse of Drugs Act and to be more cooperative in allowing for these facilities to become forward in an easier and more speedy process.
Okay.
A few weeks ago, Neil, when I was at the facility, and I posed a very similar question to the Lord Advocate, what was apparent to me was the express wish of those who were present for some sort of inhalation room to be put in place, and similarly for a mechanism to allow for single-use tourniquets to be used as well. Now, the Lord Advocate, in her response to myself, said that she had not been asked about the potential for inhalation or asked to develop any policy differently because of the need to assist in the application of tourniquets. Do you have any intention to seek any changes on that front?
I thank Mr. Flynn for his question. It's important consideration as to where both the staff and the Health and Social Care Partnership feel the facility can be best deployed in order to respond to those that are using it. Obviously, it is currently a facility that supports injection, but I've heard in my tour of the facility from staff around the potential for an inhalation facility to be established. That would need to be applied for. They would need to submit to the government and to the Lord Advocate their policy basis for doing so, and it would be for the Lord Advocate then to consider whether or not that was appropriate, and for us to consider whether it would be practicable. In terms of tourniquets, that's currently prohibited under the Misuse of Drugs Act, and again, should there be an application for those to be facilitated within the facility, then that would need to form part of the Lord Advocate's consideration. As she said, there is no application currently in the system, but I understand, because of the changing nature of substance dependency, that the current establishment of the facility on an injection facility basis may provide limitations. And there is international evidence to point to the relative success of inhalation facilities, and I'm happy to bring Ms. Zabayas in to provide greater context on the international elements if Mr. Flynn would be content with that.
Yeah, please.
Thank you, Cabinet Secretary. So I was simply going to note that there is international evidence that inhalation rooms are standard components of safer drug consumption facilities. So we see that, for example, in many of the facilities operating in Germany, in Denmark and France, where their role in preventing respiratory harm is noted in the evidence base as a result.
Thank you.